Prostate cancer, early signs, causes and prevention. Imagine having the ability to shield yourself from one of the deadliest cancers affecting men today. Prostate cancer is a silent threat that takes thousands of lives each year, yet early detection can make all the difference. According to the National Institute of Health, prostate cancer is the most common cancer among men in the US and ranks as the second leading cause of cancer-related deaths. The alarming reality is that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. In 2024 alone, over 30,000 men lost their lives to this disease, and in 2025, more than 100,000 new cases are expected in the US. The good news? Prostate cancer doesn't have to be a death sentence. Recognizing the early warning signs and taking action can drastically improve survival rates. Unfortunately, many men neglect their prostate health until it's too late. The prostate is a small, walnut-sized gland located just below the bladder and in front of the rectum. It surrounds the urethra, the tube responsible for carrying urine and semen out of the body, and plays a crucial role in reproductive health, producing a fluid that makes up about 30% of semen, nourishing and protecting sperm cells during ejaculation. Additionally, the prostate contributes to muscle contractions that aid in ejaculation, highlighting its importance in fertility. In this video, we'll uncover 12 early signs and symptoms of prostate cancer that often go unnoticed. These subtle indicators can be easy to overlook, but identifying them early could be life-saving. If you're over 40 or have a family history of prostate cancer, this information is essential for you. Here's what you need to know. Despite how common prostate cancer is, many men remain unaware of its early warning signs, leading to delayed diagnoses and more difficult treatment. The lack of awareness only increases the risks. Age is the most significant risk factor, with the likelihood of developing prostate cancer rising sharply after 50 and being most prevalent in men over 65. What makes prostate cancer especially dangerous is that it often develops silently, with no obvious symptoms in its early stages. However, as it progresses, it can cause a range of issues, from urinary problems to pelvic discomfort. Understanding these symptoms and prioritizing regular screenings can dramatically improve the chances of early detection and successful treatment. Now, let's explore the 12 early warning signs that can help identify prostate cancer before a medical test confirms it. After reviewing these symptoms, we'll also discuss the common causes of prostate cancer and what you can do to lower your risk, so be sure to watch until the end. Have you ever noticed blood in your urine? This concerning symptom, known as hematuria, could be a warning sign of prostate cancer. It may appear as a pink, red, or brown discoloration in your urine, though in some cases it's only detectable under a microscope. The presence of blood often indicates an advanced stage of the disease, making it crucial to seek medical attention immediately. While other conditions like urinary tract infections or kidney stones can also cause hematuria, it's essential not to ignore this symptom. Early diagnosis and treatment can improve outcomes, so stay alert to any changes in your urinary habits. Are you experiencing trouble urinating? This symptom can manifest in various ways, such as difficulty starting urination, a weak or interrupted flow, or the feeling that your bladder isn't fully empty after going. The reason? Prostate cancer can put pressure on the urethra, restricting urine flow and making the process more challenging. Imagine this. You go to relieve yourself, but suddenly you find it difficult or even impossible to urinate while standing. This unexpected change can be both frustrating and concerning, pointing to a potential underlying issue. As prostate cancer progresses, it can cause the prostate gland to enlarge. This enlargement may press against the urethra, obstructing urine flow. As a result, some men may find it easier to urinate while sitting rather than standing. Do you feel a burning sensation when urinating or during ejaculation? This discomfort, which can range from mild irritation to intense pain, may indicate that a cancerous growth in the prostate is irritating or blocking the urethra and surrounding tissues. Interestingly, this burning sensation can also signal inflammation, making it even more important to seek medical evaluation if you experience persistent discomfort. Do you often wake up multiple times during the night to use the restroom, leaving you exhausted the next day? Frequent nighttime urination, known as nocturia, can severely disrupt sleep and lead to chronic fatigue. While it's common for bathroom trips to increase with age, a sudden or noticeable rise in frequency shouldn't be ignored. Since prostate cancer can cause the prostate gland to enlarge, it may put pressure on the bladder and urethra, leading to an urgent need to urinate more often, especially at night. If you find yourself making more nighttime trips to the bathroom than usual, it's worth discussing with a healthcare professional. Did you know that sudden, unexplained weight loss could be a warning sign of prostate cancer? This symptom is often dismissed as a result of stress, dietary changes, or increased physical activity. However, if you're losing weight without any intentional changes to your eating or exercise habits, it's important to take note. Prostate cancer, particularly in its advanced stages, can lead to unexpected weight loss as it spreads to other parts of the body. This happens due to the body's increased energy demands and the cancer's impact on metabolism, causing a noticeable drop in weight. If you experience significant weight loss without a clear reason, it's essential to seek medical advice. One of the more serious symptoms to watch for is persistent bone pain, especially if it isn't linked to any obvious injury. Here's why this is significant. As prostate cancer advances, it can spread to the bones, leading to considerable discomfort. This type of pain is often felt in the spine, hips, or ribs and can range from a dull, lingering ache to a sharp, stabbing sensation. Unlike common aches and pains, bone pain caused by prostate cancer doesn't go away on its own and may indicate that the disease has reached an advanced stage. Do you constantly feel drained, even on days when you haven't been particularly active? This could be an overlooked warning sign of prostate cancer. Unlike typical tiredness, cancer-related fatigue is a deep, unrelenting exhaustion that doesn't improve with rest. It can either build up gradually or hit suddenly with overwhelming intensity. The worst part, this type of fatigue is often more severe than everyday tiredness, as it's caused by the body's response to cancer, the energy demands of tumor growth, and sometimes even the side effects of treatment. Discovering blood in semen can be a distressing and unsettling experience. Known as hematospermia, this condition may be linked to prostate cancer, as a growing tumor can disrupt delicate tissues and blood vessels within the prostate, leading to leakage of blood into the semen. This may cause semen to appear pink, red, or brownish. While blood in semen can also occur after prostate cancer treatments like radiation therapy or surgery, frequent occurrences should not be ignored. If you notice this symptom repeatedly, consult a healthcare professional for a thorough evaluation. Did you know that prostate cancer can sometimes cause symptoms that seem unrelated to the prostate itself? One such sign is weakness, numbness, or tingling sensations in the legs or feet. This occurs when the cancer spreads to the spine and compresses the nerves that control leg movement. As a result, men may experience difficulty walking or maintaining balance. In severe cases, this nerve compression can even lead to paralysis or loss of bladder and bowel control, making early detection and treatment crucial. The human body is an interconnected system, and prostate cancer's effects can extend far beyond the prostate gland. Pain in the pelvic region, lower back, or upper thighs can be a warning sign that the disease is spreading. When prostate cancer metastasizes, it can affect nearby bones and lymph nodes, causing inflammation and swelling. This pressure on sensitive nerves results in persistent pain that radiates from the pelvic area to the back and thighs. If you experience ongoing discomfort in these areas, it's important to seek medical attention. Struggling to maintain an erection. Erectile dysfunction, ED, is the inability to achieve or sustain an erection firm enough for sexual activity. While ED can stem from various causes, it may also signal prostate cancer, especially if it occurs without a clear reason. Here's the catch. Even if the cancer itself isn't directly responsible, prostate cancer treatments, such as surgery, radiation therapy, and hormone therapy, can damage the nerves and blood vessels essential for erections, leading to long-term erectile dysfunction. If you're experiencing unexplained ED, don't overlook it. Consult a doctor to rule out any underlying health concerns. Understanding the causes of prostate cancer can greatly improve your chances of preventing this serious disease. So, what exactly leads to its development? Prostate cancer arises when normal prostate cells undergo genetic changes. These mutations can either be inherited or acquired over a person's lifetime. Interestingly, inherited gene mutations account for roughly 10% of prostate cancer cases. Genes like BRCA1 and BRCA2, commonly linked to breast and ovarian cancer, can also elevate prostate cancer risk. Meanwhile, acquired mutations occur randomly as cells divide, sometimes leading to uncontrolled cell growth and tumor formation. Think of DNA as an instruction manual for your cells. When errors occur in these instructions, they can cause cells to grow uncontrollably, ultimately leading to cancer. But genetics isn't the only factor. Several lifestyle and environmental risks also play a role. Diet and obesity. Men who consume a diet high in red meat, high-fat dairy products, and processed foods may face an increased risk. On the other hand, diets rich in fruits and vegetables can offer protective benefits. Lifestyle choices. Smoking, excessive alcohol consumption, and lack of physical activity can contribute to the risk of prostate cancer. Race and ethnicity. African American men are at a higher risk compared to men of other racial backgrounds. Family history. If your father, brother, or close relatives have had prostate cancer, your risk more than doubles. While understanding these risk factors is important, the real key is prevention. Let's explore some of the best ways to reduce your chances of developing prostate cancer. While no method can completely eliminate the risk, adopting a healthier lifestyle can significantly lower your chances of developing prostate cancer. Adopt a nutritious diet. Since you are what you eat, maintaining a well-balanced diet rich in fruits, vegetables, whole grains, and lean proteins can do wonders for your prostate health. Foods high in lycopene, like tomatoes, and omega-3 fatty acids, found in fatty fish, may provide additional protection. Maintain a healthy weight. Keeping your body mass index, BMI, within a healthy range can help lower your risk. Losing excess weight and avoiding obesity further decreases the likelihood of developing prostate cancer. Stay active. A sedentary lifestyle is linked to many health issues, including prostate cancer. Incorporating at least 150 minutes of moderate aerobic exercise per week can significantly benefit your overall health and reduce your risk. Schedule regular screenings. Proactive health checkups can provide peace of mind through early detection and timely treatment. Consult your doctor to determine the right time to begin annual prostate screenings, especially if you have a family history of the disease. Early detection is the most powerful tool in fighting prostate cancer. Pay attention to any warning signs, maintain a healthy lifestyle, and stay informed about risk factors. If you found this information helpful, don't forget to like, subscribe, and share this video with friends and family to help spread awareness. Now here's a question for you. What steps are you taking to stay proactive about your health?